Hi, everybody, and welcome to another episode of Wellness Wednesday Inspiration. As usual, my name is Fernanda Torres, and I'm here with Dr. Linda Marquez. And we have a guest today. I'm pretty excited. I will let Dr. Linda tell you a little bit more about her. And the topic that we're covering today is quantum biofeedback and how doctors are using energy medicine to map a patient's health. Dr. Linda, how are you doing today?
Great. Happy Wednesday. Everything is going amazing. And we both kind of had this same experience this past weekend.
Yes, we
did. For
the
first time you went and experienced the flotation tanks. So, and the cryotherapy.
I need to tell you how it went. So the float, I went in and I remember going in and I remember taking a few deep breaths and calming and quieting down my mind. And then the next thing I know, it's like, okay, you're ready to get out of the tank. I'm like, what? An hour went by just like that. I did not realize where time went. It was so amazing. And then after the fact, I felt like I was floating for the entire day. It was so relaxed. I was so mellow. And the place where I went, they also had oxygen therapy. So I did oxygen therapy for like 15 minutes, eucalyptus. So even more relaxed. It was so amazing. It was awesome.
So you're definitely going to go back and probably try to make that part of like your routine, even if it's like on a monthly basis, or they have packages that a lot of
them have memberships. Yes. So you can go once a month, you can go twice, 3 times a month, or like unlimited times, depending on the price. And that's one of the first things that I asked. Okay, so how can I get this more often? Because it's awesome.
It is amazing. And from what I've experienced too, because I have gone in the past, and every time I leave there, like you said, you feel like you're floating, your mind is clear. And most people think, because there's different types of flotation tanks. Some are like a pod, it looks like a bean, and you go in there and it's really small. But this was actually like a huge tank that's stainless steel. I mean, it's pitch black dark in there. And it's maybe 12 inches high of, water with the Epsom salt. So it's a pretty amazing experience. And you really get into that alpha theta brainwave where that creativity and that relaxation comes in, but also just having all the magnesium that your body's absorbing. That really helps with, resetting your adrenals. So you walk out, I walk out feeling like, I just got a really good night's rest, and I'm ready to go, but at the same time, I'm relaxed and calm. So it was pretty awesome. Yeah.
It's pretty cool for anybody that has not done it before. It's so cool how literally you just float. I mean, there's nothing that you do. There is nothing to do. Literally, it's just lay down and don't do anything, and the water does everything for you. So it's amazing.
Yeah. And sometimes that inner chatter goes on between people and their own mind, but that's the beauty of it, is you get to practice this time and really just focus on you. And if a thought comes in, our guide there just said, he goes, just acknowledge it and just let it go. So you can go in there, and even with meditation, acknowledge a thought is there, and they tell you, okay, imagine it's on a cloud and it's just passing by. Next.
So. That's true. And as I was doing the oxygen therapy, they had books in this place. It's kind of like a quiet living room, and you just sit and they do the oxygen and whatnot. And they have books for you to read. And I had some books. I always carry books with me, right? Because I'm a reader.
Me too.
But I found a book that I had been wanting to read. So I started reading it for like 15 minutes that I was doing the oxygen therapy. And I was hooked on the book, so I had to buy it. Now I'm reading it. The book is, I have it here, 10% Happier. Have you read it?
No, I've heard of it with Dan Harris. I've heard of the author. Yes.
Okay. So it's a good book. It's about meditation and the voice in the head and quieting down the mind and the benefits of meditation and all these things. But he adds like some comedy. He's a little bit sarcastic. Yeah. So it makes it funny. It's not like the typical meditation is for this and this and that, and like so serious. He puts like this added touch to it. So it's a pretty good book to read, pretty fun to read.
Oh, I'm definitely going to have to look into that. So, do we have our doctor? Is our doctor on board now?
Not yet. We're waiting
Not
for her.
yet. Okay.
I'm gonna send her the link once again. So see if she can join in the next couple of minutes.
Okay. Well, one of the things I did try that was brand new, and I have never done this before, and I think I had shared and created a little video, was the Pandora meditation. I don't know if you've heard about that. That
No,
was
I
the
haven't.
first time I experienced it. What's really amazing about these flotation centers, you could feel, and we're going to get into about energy and medicine and so forth, but you can really feel the vibes when you go in there, the energy of the people. And the gentleman that was taking care of us, he was one of the owners. He was just so chillaxed, just such a smile on his face. You could just feel the love just exuding. And that's one of the amazing things about going and trying different modality. Maybe the first time it may not settle with you. The second time you might get more out of it. So a lot of it also depends on your own state. Where are you? And maybe you didn't feel a big experience the first time. You got to give it at least a second chance, because I just personally can't see anybody not do well with flotation therapy unless they're like claustrophobic and just afraid of dark spaces. But this one was a huge tank. It wasn't a small pod. So it was amazing.
That's awesome. And the cryotherapy, that was also a new experience
Yes.
for me. Call me crazy, but I'm like, okay, I'm coming from Chicago. I'm escaping the cold, and now I'm here. Like, what am I doing? But it was good. It's 2 minutes, pretty intense. The
Yeah.
2 minutes that you're there, it's so intense. I was freezing for hours after the tank, but I did feel my muscles. I was sore from working out.
Mm-hmm.
My legs were sore, my abdomen was sore. And after the cryo, actually the next day I woke up and I'm like, nothing hurts. It's good. Life is good.
That's great. But, and the flotation tanks, you have the same experience. I don't know if you noticed that as well, because of all the magnesium. And I feel the same experience, and I enjoy both of them. So I don't know which one would be the winner for me. They both have their benefits. So
They do. They do. And they're completely different experiences. I mean, night and day, it's the experience. I don't think there is a way to compare really, how the experiences go, but they were both amazing. Mm-hmm. And now we gotta do the salt again.
I did a mini one, and I really, we'll have to see that for another one. But I would like to go to a big salt room. Halotherapy, that's what it's called, and you probably have more experience with that.
Mm-hmm. So that would be that's a good experience. I have tried that before, once before, and that was a good experience.
Okay. So that's been a while since you've done that.
It's been at least like a year and a half.
Okay.
Quite a while back in Illinois.
Well, now that you're in the Phoenix area, maybe there's a place that you can find in that area. So this other one. Did. Oh, you did? You found one there?
I did find one.
Okay. See, there's just a lot of different modalities and alternative therapies that people can experience. And I think the beauty of it is we can bring our own experience. However, I always feel that a person should try it, because my experience may be very much different from theirs, and everyone benefits something a little bit different. Like with cryotherapy, if you're depressed, you're going to walk out of there. You're not going to be depressed, because you're like, woo! It's kind of like going outside when it's super cold, and it just stimulates your nervous system to turn everything on to get that blood flow going and increase your metabolic rate so you don't freeze to death. So it's really an amazing feeling. So well, we're hoping to get Doc on. Not sure if she's on yet. So
not yet.
Okay.
We're trying to figure out why she's not able to come in yet. She says that on her end, she sees that she's backstage, but I can't see her here on my end. So I don't know.
You know what the biggest mistake sometimes is? They have to enter the room. That was the problem.
Oh, let me tell her.
Yeah. So it's Wednesday, and for all of you, I know we have listeners everywhere. It's well, it's the start of fall for some people. It's the end of September. So here in Arizona, it's definitely starting to cool down a little bit. We're still in the triple digits. That might seem crazy to some people. You're in the triple digits still, right, Fernanda, down in the Phoenix
Yeah.
area?
Yes.
But it's the low triple digits. It's not like 120 or 119.
No,
So
it doesn't feel as intense anymore.
no, and the mornings are a little bit cooler, and that feels really nice. And I think now, usually when you start getting into the 90s, the 80s, oh, it's magical out here. And then just the mountains, and it's actually beautiful. So I'm excited for you to experience your first fall out here and winter.
I can't wait. I think the summer is finally almost over. So now we get to experience the nice weather in Arizona.
Mm-hmm.
All right. So do you want to introduce Dr.
Amadi? Absolutely.
Now?
All right. Well, the interesting story is there are no mistakes. I met Dr. Hep, and they call her Dr. Hep for short, years ago at a business mastermind. And that's the beauty about going out to conventions, and you're going to a retreat here soon. In gatherings, when you're trying to improve you or some aspect of your life, you meet the most amazing people. So when I met her, there was something about her. I knew she was a medical doctor, but there was something different about her. I was like, I gotta get to know her. She's calm. She's confident. She's calm. There was just a different vibe about her. And so Dr. Hep, she grew up, I believe, in New York. She went to Bronx High School, the High School of Science. So I'm assuming that that's kind of like the Hall of Fame type of high schools, or the Orange County Performing Arts type of high school back in the 70s. And she graduated from SUNY at Stonebrook Medical University or College. In 1987, she won the honors in a family practice and a prize for a paper that she wrote on public health policy. So she had practice and did her family practice residence at Bronx Lebanon Hospital. And while she was in medical, she also was one of the student representatives to the American Association for Family Physicians. In 1990, upon finishing her residency, she then moved to Miami, where she currently resides. And she was on staff there at Jackson Memorial Hospital. And so after years of doing that, in May of 2001, so almost 20 years ago, she decided to open her own practice and combine the best of, we say, Western medicine and Chinese medicine. So that's kind of interesting, and actually implementing a nutrition and lifestyle medicine, what we're seeing that's becoming the new norm now. So I'm excited to have her on because she works very differently with her patients, and she's also even incorporated this really interesting modality that I really want to hear more about, is the biofeedback and how they're using it and the phenomenal results. And I always say, with medicine, they wait till the science, they have to wait and say, oh, science doesn't, show that that's true or whatever. But, some things just take forever and they're behind the curve. And I really think that she's way ahead of the curve with how she's working with her patients. So I'm excited to have Dr. Hep on the show.
Let's bring her in. Hello, Dr. Hep.
Hey, there she is. Hi, Doc.
Thank you so much for inviting me. I'm so sorry I was having technical difficulties, but very happy to be here.
You're here. That's all that matters. Thank you for joining us today.
Oh, sure. My pleasure. So,
how is your Wednesday?
It's going okay. It was raining a little bit earlier, and I'm kind of home alone, which is... I say home because, this office is where I spend probably more waking time than I'm sure you're familiar with that scenario. So, yes.
Where are you located at, Dr. Hep?
I'm actually in a place called Coral Springs, which is sort of west of Fort Lauderdale and a little bit south of Boca Raton.
Oh, okay.
Yeah. So I'm in Broward County in South Florida.
South Florida.
Yes,
All right.
beautiful South Florida.
Well, thank you for joining us today. We're excited to have you.
Well, I'm excited to be here. Would you like me to just start talking about quantum biofeedback? And I'm
Well,
so passionate about it.
you know what intrigues me is one, it's like, how did you get into, I mean, most traditional, you went to traditional medical school, and it's more about a lot of emphasis on toxicology, diagnosing, pharmacology, and person has this, you give them this. Kind of like you match the symptom in the drug. You've gone kind of way the opposite direction, but you still use pharmaceuticals when necessary. However, your practice is just very unique. What intrigued you to kind of go in that route? Because there's usually a story behind the story. A doctor just doesn't do that and just all of a sudden believes that, oh, I'm going to go do this. There's usually a story behind that. So I'm kind of curious to hear your side on that.
Well, it's funny that you should ask that, because a lot of patients have asked me that, and they ask me, well, how come you think so differently than most other medical doctors that I've ever met? And really the answer to that predates my going to medical school. Really, it has to do with my parents. I mean, they were both journalists, so they taught me how to analyze information that I was being presented with, taught me how to read between the lines, and also taught me how to consider for whose benefit am I being, shown this information. And so, unlike a lot of my classmates who kind of believed every single thing that they were told in medical school because it was told to them by the professors, there were certain things about our medical education that never made sense to me. It never made any sense to me that nutrition was not regarded as important. And just to give you an example of that, when I first got to State University of New York at Stony Brook, and back in 1983, there was no course on nutrition. So the people who were in my year got together and asked the administration if they would kindly offer us a course on nutrition, and they made one available. And that course was only half a year long, as opposed to pharmacology, which was a full year long. And it was even optional. You didn't have to take it to graduate. And even if you took the course, which I did, it was really just a cursory overview of all of the nutritional deficiency disorders and what was the minimum amount of nutrients that you had to take to avoid getting things like scurvy and beriberi and so on. But I'm only saying this to say that I never went into medical school with the idea that that was going to be the be all and end all. And I never went into medical school with the idea that that was always the best approach to things. I was always more interested in optimizing health and preventing disease than I was in managing disease. So even though, they taught me mainly how to manage disease with drugs and surgery, I didn't want that to be, the final word on how I would manage patients. So after I graduated from residency, a few years after that, I went back to school because I just couldn't get enough of it. No. I went back to school for acupuncture and traditional Chinese medicine. So I'm actually a licensed acupuncturist in the state of Florida as well, although I don't really do the sticking needles in part anymore. But I'm just saying that I did that because I wanted to have additional armamentarium to treat patients other than just with medications. So, I was doing acupuncture and traditional Chinese herbs. And then I started doing another technique, which you probably have heard of, NAET. Was doing NAET for a while, and then I met a colleague at an advanced NAET seminar, and this was in Orlando. And when we got back to South Florida, he called me up sometime after that and said, would you like to see a device that I sometimes use in my office for treating certain patients? So I said, sure. And he sent his nurse, Christine, up the road from Miami, where he was practicing, to Broward, where I practice, with the device. She gave one demonstration of it to somebody who I was sharing space with at that time in the office. This is a licensed massage therapist, and she allowed me to see the screen of this person, and I was just flabbergasted at the information that I saw coming up about her that I knew had not been entered into the device. So after she had her treatment, I had my treatment, and I'll just tell you that a really stressful thing had been going on with me for about the year before this happened. Really stressful. I mean, just so stressful. In any case, I didn't go see a medical doctor about it because I knew that all they were going to do was do my physical exam, do routine blood work, and check my vital signs. And when all those came back being relatively normal, then they were going to either offer me medication for anxiety or medication for depression or medication to help me sleep, which I had started having difficulty doing, although I never in my life before had difficulty with that. But I knew that that's all they had to offer me, and I wasn't interested in taking those kinds of synthetic pharmaceuticals, so I just didn't bother to see them. But all I can tell you is that how I felt before this treatment, during this treatment, and after this treatment was just so totally different. I mean, it felt like a light bulb being turned on. I mean, I felt so terrible beforehand and so much better afterwards that I was so intrigued that I went to get several more of these sessions because I thought, oh my God, I feel so much better. I can't believe it in such a short time. I mean, the treatment took about, I'm going to say at least maybe an hour, hour and a half. But I mean, to go from feeling one way to feeling totally differently within that span of time was incredible. And so over the next several months, I went down and visited this doctor in Miami several more times. And each time I went, I felt better and better and better until finally I became so curious about it that I attended a convention where everybody who was there had one of these devices and was learning more about how to use them. And once I learned all the different information that you could see about how a person was functioning and to actually do something about it right then and there, you know, have treatment that was individualized to that particular person at that particular point in time and that was totally non-invasive. It was just magical. And that's when I decided, you know, I've got to get one of these devices. So that was back in May of 2003, and it took till August of 2003 before I got my first device. So I've been practicing with it for the last 17 years, and it has been totally mind-blowing.
Wow. Wow.
And one thing which I should mention, I'm sorry to butt in, but I just wanted to put this out there, and that is that this device can be used to assess a client or patient who is not there physically. The assessment part is equally accurate, whether they are physically present and connected to the device or not. You can even actually, and I'll use this word, you know, with some caution in case the FDA is listening, but you can actually treat a person at a distance too. And when I say treat, I mean harmonize their frequencies because we're all energy. And so part of us is local in nature, the physical part, but the other part that's the energy, that's non-local. So you can, if you have the right equipment, you can tap into it and you can interact with it. And I would say that the power of doing that kind of treatment at a distance is about, this is my own estimation, it's about 70% of what it would be if the person were actually there and hooked up. So just wanted to say that. That's been more popular in these days of COVID.
Yes.
Definitely, with all the remote visits and people staying at home, definitely. Can you tell us a little bit more about what this specific thing is, how it works, what type of conditions does it treat? Is it for anybody? Are there any precautions or anything else about it?
Well, the only precaution is that it's not supposed to be used, you know, when a person is hooked up if they have a pacemaker. Even then, I don't think it would hurt them. I think that they're mainly saying that for liability reasons. You know, this is America, and so you have to be really careful. Okay, but other than that, there's really no contraindications. It can be used for anybody. And the only things for which it would not be helpful are conditions that require, imminent surgery. If it's a chronic functional medical condition, then it can be addressed with quantum biofeedback. So
Wow.
anything, I mean anything, and that's one of the things that for me is so much fun about it, because I'm a family practice doctor, which means that I enjoy seeing a great variety of things. So I see all the garden variety stuff, hypertension, diabetes, overweight, arthritis, anxiety, depression, difficulty sleeping, you know, um, kidney problems, all sorts of things. And there's so many different therapies that you can do in quantum biofeedback that would help all of those conditions. So, that's one reason why I'm never bored. And sometimes, even when I see diagnoses coming in the form of people, or people coming in that have been said to have certain diagnoses, even if I have never encountered that in person from a patient before, looking at them on the quantum biofeedback device gives me a lot more information as to what's really causing the problem, and then allows me to start addressing it, not only in terms of physical things, but in terms of the patient's psychology and emotions as well. And, that drives everything.
Wow.
So when somebody comes into the office, like say I was a new patient, I come into the office and I'm just like, I was referred to you, Dr. Hep. I just know you have this machine of some sort that's supposed to help me. What does that look like? Am I being connected to something? Or do I have electrodes? I mean, is this going into your computer?
I don't know if this would be advisable, but let's see. I might even be able to show you this. So since I'm on the phone, let's see what happens.
That would be awesome.
Let's see.
Yeah, if I
I'm curious.
Well, I'm curious for two reasons. One, the in-person, and then the remote. And a lot of it tends to be based on frequencies and energies, which we know that we are a frequency. We are electrical beings, and that's very obvious. If you're ever in an accident and you injure your head, what do? They're going to check the frequency in your brain, right? And if you're having a heart attack, what are they doing? They're checking the frequency in your heart, right? So,
well, see, that's the interesting thing. In Western medicine, the only two organs of the body that they check what's going on with them electromagnetically is the brain and the heart. But obviously, the whole body is electromagnetic, not just the brain and the heart, and that they never check on the electromagnetic status of the whole rest of the body. So anyway, I'm not sure if you'll be able to see this. Let's see if I can. So it's a typical laptop. I'm not sure if you're seeing this, but anyway, it's a laptop, and then it's connected to a little box that has a plate on top of it that you can put items if you want to. And so it has all kinds of therapies on it. Like, for example, it has balancing a person's acupuncture meridians. One can do that without needles with quantum biofeedback. Believe it or not, I mean, there's so many different therapies that if I were to even tell you, it would probably take up more time than what we have. But there are so many different ones. And also, I like the ones, my personal favorites are the ones that are in NLP, neuro-linguistic programming, because that's where you can do stuff like even reduce a person's stress with the click of a mouse.
Wow.
I mean, it doesn't get better than that.
That's
And unfortunately,
amazing.
yeah, most of the time when people go to their medical doctor's office, unfortunately, they don't feel any better when they're walking out than they did when they were walking in. And in fact, sometimes they feel even worse because
Mhm.
of things that the doctors told them. But leaving that aside, when people have quantum biofeedback treatment, almost always they leave feeling a whole lot better than when they came in. It's just amazing. And that's one of the things that for me is so much fun. And that's why I keep doing it.
That was one of my questions. Do you find that that result that you had was kind of like an isolated result, or is it like what you normally see on patients? Is it most of the patients, when they receive this treatment, will walk out within an hour and a half, feeling that much different?
Most of them do. I find that people differ as widely in their ability to sense electromagnetic fields as they do in, let's say, for example, their hearing. So some people are completely deaf, and other people can hear, a wide range of sound, and lots of people are somewhere in between. So I happen to be one of those ones that's extremely sensitive to electromagnetic fields. So
Mhm.
for me, it was you know,
Right
just
away.
really amazing. But for a lot of my patients, they do experience a big benefit, um, because a lot of my patients are more sensitive than the average doctor's patients, because with very sensitive people, Western medicine can be particularly harsh. And so a lot of times patients come to me after they've come to other doctors because the other doctors weren't helping them, or they were giving them drugs that were maybe making them feel bad. And so they felt like they had to try something else. So I have a
Mhm.
patient population that is, you know, both more open minded and also probably more sensitive than the
Sensitive.
average.
Mhm.
But they do sense the difference, and I even can see some people who are really sensitive. I can see their numbers. There's a set of numbers that's measured every time that the person is seen on the device, and I can see changes in those numbers even from the beginning to the end of therapy. So I have both the patient's report as to how they're feeling, which is of course subjective, and then I also have objective measurements of, well, how have their numbers improved in this particular session.
Mhm. Awesome.
So when you're in person, are there, because you said you've worked with patients remotely, especially with COVID, and probably with all types of patients, probably internationally as well. When you're in person, are their hands on them on a modality? And how do you work with them if you're working remotely? Because I know it's all
Well,
energy, and I want to like people to kind of understand, because we're at a different level where we understand vibrational frequency. And you get into quantum physics, it's like, whoa, mind blowing, but to kind of just bring it at a level like that's just super easy to understand, to simplify it, so to speak, would be
well,
great.
if they're here, then they will be connected up by something that's called the harness. So this will entail like bands that, oh, I'm so sorry. I wanted to get rid of this. Hold on. Um, hide this somewhere. Okay. I thought we wouldn't have that issue, but anyway. So if they were here, they would be connected up to um, uh, a harness that goes to their wrists and ankles and also across their headband. And so
Okay.
they would be getting frequencies through the harness. But even if they were here in person, they would also be getting other frequencies that are not through the harness, that are through what the inventor of this device, Bill Nelson, calls subspace. So, there's all kinds of spectra of frequencies out there. And when they're here, they're getting two kinds, one through the harness and one that's not through the harness. one that's somehow generated by the computer. And please don't ask me how that happens because I am not a physicist by any stretch of the imagination. Okay. But when the person is not here, then they're only getting the subspace frequencies, not the ones that are going through the harness. And, you know, I've been asked many times by patients to try to explain to them how this could happen. So usually I'll just tell them, well, if you had a radio, let's say, and you tuned it to a specific station, then you would only be hearing the frequencies that are coming from that station, regardless of the fact that there would be all these other stations out there broadcasting radio, TV, Wi Fi, cell phone, all these frequencies out there. But if you had a radio and you tuned it to a station, then you'd only be hearing what's coming from that station. So the quantum biofeedback device is able to tune in to the characteristic frequencies of a person, believe it or not, even if they've never been physically hooked up to the device. Even if I just enter their information, name, date of birth, place of birth, that just enables the device to kind of, if you want to say, find them. But the information that I'll be getting from them is in real time in terms of what's going on with them then, not in terms of any stored information about what has been going on with them previously. I know this firsthand because when I first got the device back in 2003, I started treating my father, who was up in New York still, while I was down in Florida. You know, I asked his permission, explained about the device, asked him if he'd mind if I treated him. He said no, probably thinking that it wasn't going to do anything anyway. So anyway, I started treating him. And I could immediately tell once I had calibrated and tested to him that that was Dad that I was treating because I recognized his issues, you know. And then when I would treat him, those things that he mentioned were going on with him would typically get better. So I think over time, he actually did come to believe that it worked, although, you know, it's something that a lot of people have expressed a lot of skepticism in. But, you know, I've done this so much over the past 17 years, treated so many people remotely, that it often surprises even me how effective it is at a distance.
Would you say that it's more like it's better to do it in person? Is there more of a benefit to do it in person?
It is better in person for two reasons. Number one, it's the treatment effects are more powerful.
Mm-hmm.
And number two is, you know, it's always nice actually seeing the person there in person, and you can talk to them and they can talk to you, and you can see, you know, their body language and they can see yours. And so, you know, and plus which then I can actually point out to them things that I'm seeing on the screen so as to be able to explain to them why I'm thinking the things that I'm thinking about what's going on with them. You know, that part could conceivably be done at a distance as well, you know, as my practice develops. I would like to get a second screen that I could attach so that I could show my patients who I'm treating remotely in real time what information is coming up on their screen. I haven't gotten to that stage yet, but that's coming. So those are the two advantages to a person actually being there. Now, there's one advantage to the person not being there. You didn't ask me that, but I'll tell you that too. The advantage to the person not being there is that you can treat them till the cows come home. I mean, you can let therapy run on them, you know, all night if you want to. And so you're not limited by time. You're also not limited by how it affects their hydration, because with them being hooked up, it's a more intense, you know, thing, and it can use up a little bit of their hydration. That can happen at a distance as well. But, you know, it's, you can do much more extended therapies at a distance than you can when you're operating under a time constraint. So those are the pros and the cons of, you know, the other pro is that if you're doing it remotely, then you don't have to coordinate your schedule with the patients. You can just do it whenever you want to, and they don't have to be doing anything in particular. They can be sleeping if they want
Good to know.
That's really
Yeah.
powerful
It's
because
amazing.
it's kind of like prayer. You know, sometimes
Yes.
people will tell you,
In fact,
pray
that's what
for
I
me.
say to people sometimes when people express, disbelief or skepticism about, well, could this really work? Sometimes, depending upon the individual, I'll ask them, well, do you believe in the power of prayer? And if they say yes, then I say, well, do you believe that the person that you're praying for is being affected by your prayer, no matter where they are and no matter where you are? And if they say yes, then I say, well, it's the same thing with quantum biofeedback. You're sending out frequencies, whether you pray or whether you do it by this technological interface, and it affects the intended target.
Mm-hmm.
It's just not a field that's studied much, and I think one because there isn't a big financial gain
That's
to
it.
do this. So
Uh-huh.
why would we? It's kind of like, why should we encourage you to eat better, healthier foods if that's going to keep you away from the pharmaceuticals, from the
Yeah,
doctors, from everything
that's
that's
really what
tearing
it's
you
all
apart?
about. And that's why, unfortunately, most of the people, and not to take anything away from them because many of them are brilliant, but, most of the people who are doing quantum biofeedback are actually technicians. They don't necessarily have any formal medical training, although they may have, studied a lot about how to use the device. But, I feel that the fact that I bring Western medicine to it, a knowledge of Chinese medicine to it, and that I can prescribe medications gives it a whole other dimension beyond just
Mm-hmm.
quantum biofeedback. Because one of the things that I do with this, and this is a big part of my practice, is bioidentical hormone replacement. But I do it based on the results that this device shows me, not necessarily based on lab results, because lab results only show me what the person's body is making, which is interesting, but it doesn't necessarily have to do with what I'm going to prescribe for them, because what I'm going to prescribe for them has not only to do with what their body is making, but also to do with how their hormones are binding to their receptors. And that's an electromagnetic aspect which cannot be measured by a lab, but which the quantum biofeedback device can tell me more about. So, what I want to do is optimize their function. And in order to do that, I have to give them the things that their body is functionally deficient in, which may not necessarily be things that they're biochemically deficient in. So I've been able to help a lot of people with that problem, and that problem is a often overlooked area when it comes to assessment in Western medicine. Just like, for example, um, toxins. They don't assess a patient for toxins. So many causes of disease have to do with the kinds of toxins that the person has absorbed. Dental mercury, just to give you a for instance, insecticides, herbicides, pesticides, and so on.
Oh, uh-oh. Hope we didn't lose her.
I hope not. I hope not.
That's what Dr. Ali was talking about a couple weeks ago.
Yes.
Yeah.
Yes. We had that conversation just a couple of weeks ago, all about
All right.
toxins.
It says move closer to my router, so I'm gonna try that. Let's see what
Okay.
happens. Oh, there you are.
Can you hear us okay?
Yes. It's
Okay.
saying, it gave me a message to move closer to my router, so I did that and it worked.
Good. I'm glad we didn't lose you. Dr. Hep, you mentioned a little bit, or you touched briefly about us being energy, us being
Yes.
vibrational beings. And I think
Yes.
it's a concept that not a lot of people understand. And like you were saying, not a lot of people believe because we have a hard time believing what we can't see or touch, right? Can you tell us a little bit more about?
The funny thing about it is that in Western medicine, they utilize the electromagnetic aspects when it comes to the brain or the heart. So, like, for example, if you're having an arrhythmia, they might put paddles on your chest and give you a jolt of electricity to get your heart started back in a more normal rhythm. Or if the person was having, let's say, refractory depression or, whatever, they might do electroshock therapy.
Mhm.
And those are considered to be therapies in Western medicine. But, you know, practically nothing else that is electromagnetic is really used in Western medicine. I mean, maybe another example might be a TENS unit. You know,
Mhm.
Mhm.
why things work is because we're energy. That's the reason why acupuncture works. That's the reason why homeopathy works. It's all energy medicine.
So
That's the reason why
basically,
chiropractic works, crying out loud,
Yeah.
is by moving the spinal energy flow. And one can do things in quantum biofeedback that facilitate that also. It can facilitate spinal energy flow, although that they do give you the disclaimer that this does not substitute for a chiropractic adjustment.
Mhm.
But in any case, it's all energy.
Mhm.
I love that. I love how you use various modalities with, I know your mindset is so important because, our brain is electrical. Our thoughts are powerful, of course, and our words are spells, and they all have like a frequency behind that too. So can you share
Well,
a little bit working
um,
with your client, with your patients, because you do even take it to even another level where you also um, work with people's diet as well, and their spirit, their whole
oh,
being.
yeah. Well, if you don't see, that's another thing that I think is a really sad part about the way Western medicine has regressed. You know, back in like the 1950s, if you went to your family doctor, they might spend half an hour chatting with you, finding out what's been going on in your life and so on. These days, you've got like about 7 minutes with them. So they don't have time to find out about what's going on in your lifestyle other than to ask you if you drink or smoke. And they don't have time to offer you any guidance as to what you could be doing better. You know, there are certain things that are measured on the quantum biofeedback device, like, for example, degree of hydration. So if the person's only drinking a couple of glasses of water a day, they might be able to get away with that walking into a regular medical doctor's office. They would be none the wiser. But me
Mhm.
looking at their numbers on the quantum biofeedback device, I'm going to know that they're dehydrated. And then I'm going to ask them about that and talk to them about that, encourage them to drink more water, because you know what? Even though in Western medicine they make a big deal about genetics and about what germs you're exposed to, but people's lifestyle habits or their epigenetics are far more important than their
Mhm.
genetics or what germs they're exposed to. And
oh,
so I
that's
like
good.
to allow plenty of time to find out what time, and I literally ask them this: what time do you get up in the morning? What do you eat? What do you drink? How many meals a day do you have? Do you exercise? What time do you go to bed at night? Do you have a restful sleep throughout the night, or are you getting up at night? All of these things are so important. And I can even see in the patient's numbers, for example, when they're being extremely stressed, there's a certain number called resonant frequency that will go way up. So I just know whether the person themselves is aware of it, which sometimes they're not. And even sometimes they are, but they don't want to mention it to a doctor. But I already know all that just from looking at the screen.
Can't hide from you.
Can you what?
So we can't hide from you, but there's even a book called The Body Doesn't Lie, and the body is always
Yeah.
giving information.
And as a matter of fact, there's a really interesting book that I would highly recommend called The Field. I forget the author's name, but it's just called The Field. And it gives you all of these experiments that have gone on, that have been done with normal everyday people, that show that people do influence each other at a distance. There's something called heart math, which is really fascinating, where
Yes.
people at a certain proximity to each other, their heart rhythms synchronize. I mean, there's just so many interesting things about the way that we, you know, affect one another, that is all
Absolutely.
energy.
Yeah. Yeah.
Mhm. Can you touch briefly about how our emotions impact our health?
Oh, well, that's a whole thesis, but basically, basically, our thoughts, and especially our emotions, have such a huge effect on so many parts of the body, um, on our circulation, on our immune system, on our digestion, on our endocrine system. So it's not necessarily the event or the thing that happens itself, but rather what that event means to the person. And the same event could mean very different to different people. And, according to what it means to them, that's how their whole physiology is going to react. And, one of the things that I see a lot these days that is almost never assessed properly by Western medicine is adrenal fatigue. You know, when people are chronically stressed, meaning for a long period of time, that drains their adrenals. And that's something that I can help with in various ways, sometimes with bioidentical hormones, sometimes with supplements, sometimes with homeopathic remedies. But, the emotions are everything as far as the physical health goes. And since you asked this question, I have to confess that when I was first thinking about my career, I was thinking that I wanted to be a psychiatrist. And when I would talk to people about that, then they would say, well, if you want to do that, you have to go to medical school. So along the way, I discovered I was just as interested in physical stuff as in mental stuff. And along the way further, I discovered that you can't have one without the other. Every time you have some mental, emotional thing that's going to affect the physical body, and things that are going on in the physical body are going to affect the mental and emotional. And so, one of the things that I love the most about quantum biofeedback is that it enables me to be aware of and interact with all aspects of the person, not only the physical, but also the mental, the emotional, and the spiritual. Because really, how I see my role is, helping the patient to optimize every aspect of their life.
Mm-hmm. You're truly treating everybody from in a comprehensive, complete physical, emotional, mental aspect, spiritual aspect, like it should be, not just separating one part or one system in a body.
True, and that's to me really what I mean when I say holistic, really
Mm-hmm.
considering the patient as a whole. And in fact, since I am a family doctor, I love to see people and their families, and so much more about somebody when you know another member of their family. So I think of people as people, and within the context of a family, that's within the context of a community. And
Yes.
that's how I
Mm-hmm. That's awesome.
Well, Doc, can people make appointments with you from like other states? I
Oh,
know
yeah.
there's different parameters that you can practice under, not necessarily accepting them as a patient, but more as a
No, I
client.
it's in other states,
Okay.
I see patients maybe even in other countries too, but mostly in
Yeah.
other states. But if they wanted to do that, I would first suggest that they go to my website, which is www.greatnaturaldoctor, with doctor being spelled out, and then go to this place on there called required forms and fill out step 1 and step 2, and then call my office. And better to actually do this um, after next Tuesday, because right now I'm all alone in the office, and so I've been falling way behind in answering calls. So I just want you to know that, if you do this, or if you email me at dramadi@dramadi.com, I will get back with you as soon as I can.
Yeah, it'll be a little while. So just to get on your wait list for, to work with you. But I think it's
Well, normally
amazing.
I don't have that much of a wait list, but I've been behind in having office staff this month, so I'm kind of like way behind. But I intend to catch up as soon as my staff comes back next week. I'm eagerly awaiting. So,
Can you tell me your email once again so I can put it up in the chat for
sure.
everybody who's listening?
Yeah, it's DRAMADI,
Mm-hmm.
like Dr. Amadi without the period in between, all lowercase, Dr. Amadi at dramadi.com.
Perfect. I will be putting it up. That
I
looks
see
correct.
I have a salt lamp too. I love them.
You can see mine.
Yes, I love
Oh, Doc, we can spend hours just picking your brain with information about, I mean, getting,
an hour
we're
picking
both
yours.
so intrigued with the vibrational energy. And that's just one thing I wish people would understand. But I guess to some degree they do, because I always say, oh, that person's got good vibes. And essentially the good vibes is I like to call it juju, or, you know, they have energy, but we all have it. And we're always putting it off to some degree. We just don't realize. And when you become aware of it, oh my gosh, it's so powerful. And I just love how you incorporate all that into your practice and with your patients, and just really touching a lot of people's lives through your work. So it's such an honor to have you on our show.
Well, it's such an honor.
And I will tell you that I will be filling out those forms next week.
Well, you know, and also find out a lot of more information about the practice. So if you want to, you can go to the FAQs section also. But, you know, that would be great. I mean, I would love to, you know, I would love to see either one of you at a distance, or maybe both. So
we will definitely.
I invite.
Thank you. Thank you so much for the awesome conversation. Very informative conversation today. I am blown away by what I learned today, and I will be trying out biofeedback. I'm sold.
Yeah, me too.
Okay. Well, I'm excited. I'm excited to see you in cyberspace.
Yes.
All right. We'll see you soon.
All right. Thanks
so much.
Thanks so much for having us. Okay. See ya.
Bye-bye.